When most people hear pathology, they immediately think of cancer diagnostics. They think of a lump on a dog's leg, and the big question, is it benign or malignant? But that is only a tiny fraction of the story. Histopathology serves as a broad-spectrum diagnostic tool to examine tissue samples, providing context for clinical findings or directing further investigation. Why did a calf die suddenly in the field? Why is a cat's liver failing despite normal blood work? And what is this strange fungus attacking a reptile's skin? We don't just diagnose tumours, we investigate infections, toxins, metabolic disorders, and autoimmune diseases. Whether it's a biopsy from a pet or a sample from a necropsy on a farm, the tissue holds clues for us to start to unravel the diagnosis. Welcome to Down the Scope. In this series, we're going to learn how to read these clues. To understand how we solve these cases, we need to understand how we look at a tissue. We don't just look at individual cells, we look at the architecture. Think of tissue like a house. You have the bricks, like the epithelium, the wooden beams as the stroma, and the plumbing as the blood vessels. Cytology, like a needle aspirate, is like looking at the debris after a storm. You might find a brick or a piece of wood, and that's useful, it can tell you something. But histopathology is looking at the house itself, and the house can fail in many ways, not just from structural damage. Sometimes the plumbing bursts and floods the basement. We might call that edema. And sometimes the house catches fire, like in acute inflammation. Sometimes the house is structurally sound, but the rooms are filled with refuse due to failed waste removal, such as in intracellular accumulations. And yes, sometimes a new unauthorized extension is built in the middle of the street, like a cancer. To illustrate the critical importance of this architectural context, we can examine a scenario where identifying the cell type alone is not enough for prognosis. Imagine you take a fine needle aspirate from a skin lump and you see a population of neoplastic mast cells. You know what the cells are, but without the architecture, you can't determine the tumor grade, because the grading requires you to see the boundaries and other morphologic features. Are the cells respecting the property line, or are they aggressively infiltrating the underlying muscle and collagen? Cytology is enough to identify the bad bricks, but only histopathology reveals if they're destroying the foundations of the house. Our job is to walk through the house room by room and figure out exactly which system failed. Now, navigating this may seem like a complex problem, but here is the secret to learning histopathology. The body has a limited vocabulary. There are millions of things that can hurt an organism: viruses, bacteria, trauma, toxins. But the body only has a few ways to respond to that injury. It can bleed, it can swell, can send in white blood cells to fight off an infection, or the cells can undergo necrosis. This is why we start with general pathology. It doesn't matter if you're looking at a horse, a hamster, or a hawk. The pattern of acute inflammation looks very similar between the three. Once you learn the core patterns, this limited vocabulary of body responses, you can start to diagnose and categorize diseases that you've never seen before just by recognizing the reaction. Ultimately, the vet and the owner need three things from the pathologist. First, a diagnosis. What's the process? Is it inflammation? Is it degeneration? Is it hyperplasia? Secondly, what is the etiology? This is where we look for the culprit. Is there a parasite in the lesion? Can we spot some viral inclusion bodies inside the cells? Because finding the cause ultimately changes the treatment that's required. And finally, what's the prognosis? If it is inflammation, will it heal? If it's necrosis, is it irreversible, and what effect will that have on the function of the organ in the future? When we look at a slide, we're trying to predict the future by using our knowledge of past cases and their outcomes. In the next episode, we're going to start with the most fundamental concept in pathology, the injured cell. How do you tell if a cell is just having a bad day, or if it's dying?